So my current research is related to food security and physical activity and such. At DSU, I am the director of the Biomedical, Behavioral, and Allied Health Center at Capitol Park. And I'll tell you a little bit more about that center in a second. I am also the director of the Master of Public Administration program and an instructor in the Master of Public Health program. So I wear a lot of hats here, which puts me in touch with a lot of folks and get to do a lot of interesting and cool things. So a bit about the center as I get into my research. I originally, and my research obviously, my research originally going back a long time ago, over a couple of decades, started on obesity becoming a public policy area, and that continued to evolve over time. And started as I saw the horrors of the American food system diet. Also started really looking at food security, particularly working in higher ed, where there are a lot of students that face food insecurity and homelessness. And so began researching that, and obesity and food security, food insecurity go hand in hand. When DSU acquired Wesley College back in 2021, I transitioned here to DSU and became the director of the Biomedical, Behavioral, and Allied Health Center, or you may hear me shorten it to just BBAHC because it's a mouthful. So DSU has owned this building since the early 2000s, and in 2021, we really opened the doors and started building all the programs. It was essentially me building from the ground up. And this is a community embedded. We are not on main campus, but we're about 3 miles south in the Capitol Park community. And we both do research and provide community services and programs. Some of the research that happens here, whether through someone like myself, other faculty, senior research fellows, relates to food security, community safety, sickle cell trait and disease, the neuroscience of sleep, and substance use and its impact on youth. And along with this, we do a lot of community related and community programming, in addition to one-off events. We also have a summer camp, which we just completed our 4th year. We're going into our 2nd year of our after-school program. We do once monthly, and after the cuts now bi-monthly, food bank distribution events, a monthly community meeting. We have a primary care doctor a couple days a week, and other youth development programs. And if someone comes to me with a good idea and we can put it together, as long as it addresses health disparities and health inequities, we can try to make it work. Everything we do here is grant funded. So all of the programs, all of my staff, etc., I write a lot of grants to keep making things happen. So talking more about food insecurity, which is my current focus, particularly among younger youth, I've downgraded below current, traditional college age down to community level. In the US, there are 14 million children that do not have enough to eat every day and go to bed hungry. And in Delaware, this translates to about 38,000 children being food insecure. With recent cuts to the SNAPs program to provide, we once knew it as food stamps, and elimination of free breakfast and other food and community supports through the most recently passed, quote, big, beautiful bill. This will have an impact on food security overall, but certainly this will last generations. One important thing to note that most people are not aware of is 50%, half of the people receiving SNAP benefits are children. That sometimes gets lost in the conversation and rhetoric. To focus in on our community down here, we are located in Census Tract 405.02, and that's important because that frames a lot of the data and how a lot of state and federal data is gathered and presented. Our social vulnerability index is 0.94. The social vulnerability index was developed by the CDC to track how vulnerable, measuring income, poverty, all of these other things, food security, et cetera, to determine how vulnerable a community is. And in Delaware, this means that only 0.06% of communities, or 6%, are more vulnerable than Capitol Park. This translates to a poverty rate of 16% and an obesity rate of 39%. This is predominantly a community of color and historically has been and continues on. So looking at summer camp and after school, one of the places looking back I started at and keep referring back to is Fraser, among others, found a correlation between summer camp, after school programs, and enhanced physical health. These type of structured programs impact physical activity and healthy eating. So looking at this research project, our summer camp and after school programs. So summer camp, as I mentioned, we just completed our 4th year, and it is 4 weeks during the summer, half-day summer camp focused on healthy eating, physical activity, and mindfulness. And youth have a variety of visitors, activities, field trips, all around these themes. We also provide lunch and a snack daily. And then the after-school program, again, going into its 2nd year, the youth have academic assistance, homework, and then they do physical activity and are always provided with healthy snacks. So for this project, the youth participants in this are youth ages 5 to 12, which is the standard age for both our camp and our after school. And I'm looking to hopefully have about 50. This translates, knowing our numbers, of about 25 to 30 for each session of camp, plus our normal ballpark of 15 to 20 youth in the after school program. And among the caregivers, which could be parents, guardians, grandparents, aunts, whatever, whatever the setup is, of the participating youth, and many of our families are very highly engaged, aiming for about 60 for my N. And then among the staff, whether it's the camp and after school director / coordinator, which is the same person, and the other staff, which includes DSU students, some students from the Jobs for Delaware Graduates program, aiming for about 10. Just to give you a ballpark, we had 7 staff for camp this summer, and I averaged 3 to 4 staff in our after-school program. And this is a mixed methods, both quantitative and qualitative project, to get the full scope and have some of the data and numbers and statistics to support everything, but have the richness of the story that accompanies it. So looking at food insecurity, the USDA's food security module, which is a survey, and then customized surveys for the youth, families, and their staff. And this will be done at the beginning, the end, and then ideally a follow-up 6 months to a year later. Measuring physical activity, daily program attendance logs, keep track of who's here, what we did, and then of course the surveys in the same time frame. Knowledge of nutrition and behaviors. This includes our activities, and this is the surveys, but also includes information from the SNAP Ed and other CDC tools. Again, to be able to look at it in context of other national research, national trends, and data. And this will be done baseline at the beginning and at the end. And then our general demographics and information on the social determinants of health. These are given through the surveys to family caregivers, and they ask some socioeconomic, economic, and environmental, food security. Do you have enough to eat? What other programs do you participate in, etc. And this will be done at the beginning. On the qualitative side, which is, well, I can do both. I am more strongly a qualitative researcher, and I'll be conducting youth and family focus groups at the beginning, at the mid and the end, and then ideally, if we can get some folks 6 months to a year later, 4 to 5 groups to look at food access, physical activity, and overall what they think of the program, changes, things that their youth have asked about, etc. Then also doing some semi-structured interviews. These last on average about an hour, but can go longer or a little shorter depending on the participant. The youth ones are usually a little shorter. Family caregiver are usually a little longer. And about 15 to 20 of those to get their thoughts on food security, what their own household, what the programs do, and if what we are doing is actually making any impact or they're making changes. And then interviewing the staff as well to get that perspective so we can have a holistic picture of what we are doing. And currently, going back for about 4 years, I do have some basic demographic data from all of the summer camp and after school information and reports I've done for grant projects, as well as things I've observed. Also have information from the summer feeding program. This is how we get our lunches and snacks in camp. We're part of the National School Lunch Program's summer feeding program through our community partner, the Boys and Girls Clubs of Dover. And then also our after-school snacks, which we get as donations from some of our other community partners. Our regular food bank distribution events, again, I keep the numbers of those. And on the qualitative side, I also have a lot of observational data and feedback on all these programs, the summer feeding event programs, and the food bank distributions. And these, all of these together, I mentioned the external research that these impact food security and physical activity. I want to see if we are doing it and in a meaningful way here at Capitol Park in Dover, because this will help other local community orgs as well as serving as a model that can be shared more widely. This will also help me know how effective we are on a much more comprehensive way than I have with shorter surveys and conversations in the past. And determine what additional resources are needed, grant funding, community partners, visitors, trips, etc. So this is, I do want to highlight this before I take questions or have any feedback. I'm open to anything that will help better, or if you want to partner, etc. We do a mural every year. Well, this is our second year doing it. So we've done 2 and I plan to continue. On the wall, one of the walls here in the building, we have a DSU faculty artist that comes in and does the outline. And then all the kids and camp staff and everybody paints and works on it. And this is this year's mural, which is beautiful. And it's right outside the door to my office. So I get to look at it and smile every time I walk out the door. So thank you. I will stop sharing and I am back. So please, thoughts, questions, anything?